So, hello everyone. Thank you for joining us for the Navigating Mainstream Benefits WIC program and General Assistance Training. Quick intro of myself. My name is Sadaka. I'm from Home Base. We're a nonprofit technical assistance provider. We provide TA for CoCs across the nation. We work closely with the Santa Clara County's Office of Supportive Housing, and one of the many things we do in that scope is bring you trainings on behalf of OSH, including this Navigating Mainstream Benefits training. We are constantly looking to improve our training, so we will be popping in a feedback survey at the end of the training. And if you have any questions or and also any concerns that pop up, please feel free to chat with me directly. And then just to introduce you to our presenters, today we will have Laura Kwan, Jae Young Park, and Maya Vegan presenting on WIC and on the general assistance portions of the training. And just some basic Zoom housekeeping, which we are all familiar. Please keep mute. Closed captions are available. Like I said earlier, if you have any questions, please type them in the chat and you can directly chat with me. And then if there's any tech issues, like if you get booted out of the Zoom, please email at santaclaracoc@homebasecc.org and I'll be able to assist you there or someone else from my team. And now I'm gonna pass it on to Lorena, who's gonna give us a presentation on WIC. And let me just change slides. Can everyone see my slides?
Yes.
Perfect. I'll pass it on to you, Lorena.
Okay. Thank you, Sadaka. Hi, everyone. I'm really happy to be here. As Sadaka mentioned, I am the regional breastfeeding liaison for the Santa Clara County WIC program. I'm also one of the public health nutritionists. I'm a dietitian here as well. And before we get started, if you have your phone nearby, if you could please take a moment to scan the QR code on the top left corner there, I'd greatly appreciate it. Sadaka's being kind enough to circulate right there. So it's just a very short survey. It gives me an idea of kind of what you know about the program, and then later the same survey will pop up. Okay, I think we can go ahead and move to the next slide. All right, so what is WIC's mission? So WIC's mission is to safeguard the health of low-income women, infants, and children up until age 5, specifically those who are at nutrition risk, by providing nutritious foods to supplement their diets. We provide information on healthy eating. We give a lot of breastfeeding support, and we also provide additional referrals to healthcare. There are a lot of benefits to WIC. WIC has been associated with longer and safer pregnancies, with fewer premature births and infant deaths, with improved dietary outcomes for infants and children, with improved maternal health, with improved performance at school, and with also increased savings and healthcare costs compared to those non-participants. So who qualifies for WIC? So to qualify for WIC, They must be California residents. They must be in the low to medium income, meaning they are in the 185% of the poverty level. However, if they are receiving Medi-Cal, CalWORKs, or CalFresh, they do automatically meet that income requirement. So they are income eligible and they don't need to meet that low to medium income category. I do want to emphasize that WIC does not check immigration status, and participating in WIC does not impact a person's immigration status. So who does WIC serve? WIC serves pregnant women, postpartum women, those who have experienced pregnancy loss, breastfeeding women, infants, children up until the age of 5. And we can also serve dads, grandparents, foster parents, or other guardians that are legally caring for infants and children, again, under the age of 5. These are our core services. So as I mentioned in the mission statement, we provide nutrition education, a lot of breastfeeding support, breastfeeding education. We provide that access to the healthy foods, and we can give additional resources if they're asking maybe for more information on housing or substance use help or mental health. We can provide those resources as well. And this is just a little data specifically for August of this year. This is the percentage of California WIC participation based on category across all of California. So California WIC serves about 1 million participants statewide each month, and about 60% of all California resident births each year are eligible for the WIC program. So we can see in this graph here that the majority of California's participants are made up of children. So 62% of children make up the California WIC program. And we have infants at 17%. Then we have breastfeeding persons at 9%, pregnant persons at 8%, and then non-breastfeeding persons at 4%. And here is data specific to infant feeding choices for August of this year. This data is specific to the 3 agencies here. So here in Santa Clara County, there are 3 WIC agencies. There's Indian Health Center, Gardner Health Services, and Santa Clara County. So this data is specific to this area here. So for August of 2025, we can see that the main feeding choice was formula only. So that percentage is from 39% to 43%. Then we have exclusively breastfed infants from 30 to 36%. And then we have the combo feeding, which are formula and breastfeeding, from 13 to 17%. So we are always working to improve those exclusive breastfeeding rates. So we can definitely see that there's room for improvement there. All right, so here is my first question for you all. Which of the following groups qualifies for WIC in California? A, residents with, and yeah, here's the poll. You can put your answer in the poll. A, residents with high income who do not receive any public assistance. B, residents receiving Medi-Cal, CalWORKs, or CalFresh, regardless of immigration status. C, non-residents with incomes below 185% of the poverty level. Or D, residents with incomes above 185% of the poverty level who are not participating in any public assistance programs. So I'm gonna We almost have, I'm gonna wait a little bit for everyone to put in their answer. Looks like we have about 69% of responses so far, 72%. Okay, I think we have a pretty good amount of responses. So the correct answer is B, which 88% of you responded. So it's B, residents receiving Medi-Cal, CalWORKs, or CalFresh, regardless of immigration status. And as I mentioned, we have a lot of breastfeeding support here at WIC. We have International Board Certified Lactation Consultants, also known as IBCLCs, in our program. We have a breastfeeding peer counselor program as well, which I'll talk a little bit more in the next slide. We have a breastfeeding support line, so if they are on WIC, they can reach us at that number. And for those that are not on WIC, we like to refer them to the Nursing Mothers Council. And we also have a breast pump loan program. And I do want to note that Gardner and Indian Health Center WIC do not have a peer counselor program, but they do have IBCLCs on their staff. So as I mentioned, here at Santa Clara County WIC program, we do have a peer counselor program. And our peer counselors are really enthusiastic about breastfeeding. They have been trained in breastfeeding support. They have personal breastfeeding experience because they've been recruited from the population, and they also speak the language. So our participants, we have a lot of Spanish-speaking participants, so our peer counselors speak Spanish. They help to counsel to help avoid common breastfeeding problems. They provide a lot of support to those who are planning on going back to work or going back to school. They can also make other referrals, but they do not give any medical advice. And as I also mentioned earlier, we do have a breast pump loan program. So we do have manual and hospital grade electric breast pumps available. That can be loaned to breastfeeding parents who meet established criteria. So if someone's not able to get a breast pump through their insurance, or for any reason it was denied, then we can help loan them one for however long they need it.
Lorena, it's a question in the chat. Are peer counselors volunteers or paid employees?
Our peer counselors are paid employees. Yeah. Here is our California WIC card and app. In the past, they used to have checks, but they've definitely modernized. So it's like a credit, kind of like a debit card actually. So you have a little pin and you set it yourself. And the app is really helpful. We really try to encourage our participants to download it because the app will let them know how much food balance they have left, where they can find the nearest WIC office, the nearest grocery store that accepts WIC. And they can also, there's a function where they can scan specific foods to see if it does qualify for WIC. They can also see their future appointments. So it is really helpful to have. So it's something we really encourage everyone to download. So WIC provides healthy food, so they are in alignment with the current dietary guidelines. So there's a big emphasis on consuming lots of fruits and vegetables, whole grains, Lean proteins, so decreased saturated fats. So yeah, we sometimes people can complain about limited selection, but because it is following dietary guidelines, then yeah, it covers the healthy foods. So this is just an example of a food package, specifically comparing the package of someone who is fully breastfeeding versus mostly breastfeeding, versus someone that's only breastfeeding a little bit or is not breastfeeding. So we can definitely see the top row is the participants that is fully breastfeeding. They have the largest food package. They can also qualify to get food for up until the baby is 1 year. Someone that is mostly breastfeeding can also qualify to receive food up to a year, but then someone that is not breastfeeding or only breastfeeding a little bit will only be able to receive food themselves until their baby is 6 months. So part of the reason why someone that's breastfeeding more will receive more is because they do need more calories. Another part is kind of as an incentive. So we're really trying to encourage breastfeeding because breast milk is just so much more nutritious and has all the nutrients that babies need. So yeah.
Lorena, there's one more question in the chat.
Yeah,
How does the WIC card work in combination with CalFresh, or is it fully separate?
they're completely separate. Yeah, so you can be on CalFresh and WIC and you'll have your separate cards. So this is the example for a child's food package. For once a child turns 1, this is what the package looks like. And it will pretty much stay the same up until they graduate at age 5. The only difference between a child that is 1 year and then 2 to 5 is the milk and the dairy fat percentage. So at 1 year they receive the whole milk, whole fat dairy, and then at 2 years is when they start receiving the low fat options because they don't need that extra fat anymore. So that's why there's that switch. But otherwise, everything stays the same. So although, again, we do really promote fully breastfeeding as a norm for infant feeding, this is including for sick or premature babies, we do have formula available for those who are not fully breastfeeding. We recently had a change, so now we are offering Enfamil formula for the standard milk-based, and then we have the Similac formula for the soy-based option. And we also have therapeutic formula available, but this is specific to infants and children with special nutrition and medical conditions. So in order to receive these therapeutic formulas, they do have to have a qualifying medical diagnoses. For example, prematurity, low birth weight, failure to thrive, gastrointestinal disorders, inborn errors of metabolism, or severe food allergies. Some diagnoses that would not qualify would be colic, constipation, having a poor appetite, being picky, fussy, having gas or spitting up. Okay, question number 2. So, what are the 4 core services offered by the WIC program? A, housing assistance, job training, childcare support, and transportation services. B, nutrition education, healthy foods, breastfeeding support, and resources. C, financial aid, health insurance, legal services, and employment counseling. Or D, mental health services, substance abuse counseling, fitness programs, and dental care. looks like we have about 66% so far. So far, everyone's getting it right. So I'm really happy to see that. %78. Okay, I think I'll stop there since looks like things have evened out. So the answer is B, yes, which 98% of you got. Our full core services are nutrition education, healthy foods, breastfeeding support, and additional resources. All right, so when it comes to referrals, there are, I guess, two ways to do this. The first way would be to complete this form, which is the request for WIC program enrollment form. So if you think someone would qualify for WIC, then the link is provided there. Hopefully you'll be able to access the slides after. But you fill it out on behalf of the person, and then you can email that to us, or you can fax it, and then we will get in contact with that person. The other option is mostly for providers, for healthcare providers. There's specific forms, whether someone is pregnant or it's a child, and they fill out that form, give it to the patient, and then the patient will call us. So in that case, the patient is responsible for giving us a call. But generally for community programs, or other community organizations, we encourage the enrollment form, but it is not necessary either. So I'll talk about that in the next slide. So another way to apply is also to just call or text any one of our agencies. So as I mentioned, there are 3 agencies here in Santa Clara County. There is Santa Clara County Public Health, there's Gardner Health Services, and then there's the Indian Health Center. So these are the main numbers and texts. So someone can just call and say, hey, I want to apply for WIC, or they can text any of those numbers and text that they want to apply for WIC, and that process is started. So a referral isn't a requirement. The form does help because it gives us more information, can make the process faster, but it's not needed. They can just call, text, or show up to any of the offices and say they want to apply. So these are our this is specifically to Santa Clara County Public Health. These are our offices. Unfortunately, 2 of our offices closed due to budget cuts. However, our services were not affected. We are still accepting new participants, always accepting new participants. We just consolidated, shifted around. But we do have 2 offices here in San Jose. We have an office in Gilroy, Sunnyvale, and Milpitas. So if someone wants to go in person, we recommend going to the nearest office to them. We're open 8 to 5 from Monday through Friday. Okay, question number 3. This is a true or false question. A referral is required for a family to enroll on WIC. Looks like we have about 65% participated so far. Okay, there's a little bit of a standstill there, so Okay, 70. Okay. All right, so the answer to this is false. So there is no referral required. A referral can be given. Again, that form can be filled out and it's helpful, but it's not required. Someone can just call and text without needing any referral to enroll. So these are just some of the materials that we provide here at WIC. During our appointments, we give nutrition education and we can provide referrals. We have hard copies, but we also have a messaging platform where we can send links and they can open these materials. So these are some of our popular ones, our breastfeeding magazine, I'm pregnant. And then if we can go to the next slide. We also have one on the hospital experience, tips for feeling comfortable while pregnant. The breast milk one is very popular as well. It compares the nutrients in breast milk versus formula. And so we have a lot of different brochures on different topics, and I'm happy to provide brochures as well to other organizations. Okay, and here are some updates. So we are still doing appointments in person and over the phone. So we always give our participants the option, whatever is most convenient for them. Again, we're always taking new enrollments. So this year there were no farmers market vouchers. However, there is a pilot program where we received some new WIC cards that have a QR code on them that can be used at the farmers markets. So this is something that is being piloted for now. We will see if they move forward with it, but we didn't have the vouchers this year. And as I mentioned, in July, 2 of our offices closed to the public. We had to consolidate offices. And as I also mentioned, in August, we changed our standard formula from Similac to Enfamil. So now our standard milk-based formula is Enfamil. And coming up next year in April, there are going to be some changes to the food package. So we'll be sending out more information as we get more handouts from the state and all that. And this is just a little clip of, as I mentioned, they're piloting a card with a QR code that can be used at the farmers market. We only received a limited amount of cards, but for those that were able to get this card, there's a list of farmers markets that do accept it. And when they go to the farmers market, that QR code is scanned and they can use their benefits there. Okay, and this is my last question for you all. How many WIC agencies are in Santa Clara County? And it looks like we might have to type this one in the chat.
I don't think you can see it, but
Okay, I can see,
some
yeah.
numbers off. 6, 5, 3, 4, 2. There's a lot of the majority I'm seeing are threes.
Okay. Okay, so yes, that is whoever said 3, that's the correct answer. Remember, there are 3 agencies here in Santa Clara County. There is Gardner Health Services, Indian Health Center, and where I'm from, Santa Clara Public Health. So 3 agencies, and within those 3 agencies, then they each have their own offices, but 3 agencies. All right, and this is my contact information. Again, I'm the regional breastfeeding liaison. Feel free to email me or give me a call if you have any questions for me or if you want to get in touch, collaborate on something. And does anyone have any questions?
There was one question earlier in the chat. What is the maximum amount for fruits and veggies monthly?
Okay, so it's gonna differ for for children and for pregnant. It's gonna depend on your category and also on the amount of people in your family. So let's say you are a family of three and you are pregnant and then you have two kids in the program. So that amount is going to be different than someone who's just pregnant and on the program. But let me tell you what that is per person. So for children, it's $26 per month, and for pregnant and postpartum individuals, it's $47. Then it's $52 for those that are breastfeeding. So yeah, that's per person, but then you will add it up if you have a family in WIC.
Thank you. And Lorena, we have a lot of questions in the chat. For
Mhm.
time though, are you okay with responding in the chat to those questions and I'll pass it to Bay Area Legal Aid?
Of course, I will respond in the chat.
Thank you. And then I think you had one more slide though.
Yeah, if everyone can please just take a second again to scan the QR code and fill out that survey, I would greatly appreciate it. Thank you all.
Give it up one more minute just to let folks scan, and then I'm gonna change it to Bay Area Legal Aid slides on general assistance. And a reminder too, all of the slides and recordings will be sent out via email. Now I'm going to give it to Maya and Jay Young to present on general assistance.
Hi, everyone. Good morning. My name is Maya Fagan, and I'm a staff attorney. We're actually with the Law Foundation of Silicon Valley. But we share the same building with Bay Area Legal Aid, so people often get us confused. And so my colleague Jiyoung Park is also going to be presenting with me, and she is also a staff attorney at the Law Foundation. Next slide. So here's a quick overview of our agenda for today. We're going to talk a little bit about the Law Foundation and what we do, and then go into what is general assistance, how to apply, who qualifies for general assistance, due process and appeal rights. So what happens when something goes wrong with your general assistance benefits and how to fix it. And then GA, SSI, and CAPI and how those three programs kind of relate to one another. Next slide. Okay, so about the Law Foundation of Silicon Valley, we're a nonprofit legal aid organization based in downtown San Jose, and we serve all of Santa Clara County. We have three programs providing legal services. We provide services for children and youth. We provide housing services, and Jiyoung and I are with the health team. So the health program provides free legal advice and representation to folks in Santa Clara County who identify as living with mental health disabilities. And we also provide free legal help to patients of Valley Homeless Health Program, Valley Health Center Downtown Clinic, Gender Health Center through our medical legal partnership. And we also provide services to individuals experiencing homelessness in Santa Clara County. So that covers quite a few of the folks that we interact with. As far as ways that you could reach us, we do a walk-in intake hours at our office in downtown San Jose on Tuesdays from 1 to 3 p.m. So you can always send folks to meet us in person on Tuesdays. And then we also do phone intake hours Monday through Thursday, 1 o'clock to 4 o'clock p.m. And those are our live intake hours, so people can call in and speak with someone live. They can also call in at any time and leave a voicemail, and one of our community health advocates should be able to give them a call back shortly. Next slide. All right, what is general assistance? So we put a little quote from Welfare and Institutions Code section 1700 that kind of describes why general assistance was established. So I'll just read it out loud. Every county and every city and county shall relieve and support all incompetent, poor, indigent persons and those incapacitated by age, disease, or accident, lawfully resident therein, when such persons are not supported and relieved by their relatives or friends, by their own means, or by state hospitals or other state or private institutions. So this is basically the code delegating the responsibility to counties to provide this social safety net program. And on the other side of the slide is a link to Santa Clara County General Assistance Handbook. And these slides are going to go out to everyone, but this is a super useful link because this is the handbook that dictates how the program is run in the county. So if you ever have a question or you want to know why certain decisions are made or what are certain nitpicky rules that we're not going to go over in this presentation, you can refer to this handbook and it's very exhaustive. So it really goes into detail on all of the different rules of the program and how they're implemented. Next slide. Okay, what is general assistance? So as I mentioned, general assistance is a county program. It provides modest monthly cash grants for adults without children. It's sometimes called general relief, so you might see it referred to as GA or GR in other counties. Each county sets its own standards. So these programs are 100% funded by the Board of Supervisors. Everything is dictated by the county. Benefits, payment levels, eligibility requirements, they all vary county to county. So we're going to be talking about Santa Clara County today, obviously, but if you have clients in other counties or you're talking to someone from another county for whatever reason, these might differ slightly. The benefit amount can be from $11 to $343 per month. And you'll see on another slide, we'll go into benefit amounts. There's one category where you can get slightly more than, or not slightly more, you can get significantly more than $343. But in general, most people are going to be capped at $343. Monthly benefits are based on information given to an eligibility worker. Any other income may lower the benefit amount. I think that's pretty standard. If you are earning money for whatever reason or have some other form of income, that's going to affect the GA benefit that you receive. And then we also, I know some folks might be concerned or curious about how HR 1 or the One Big Beautiful Bill affects this program. This does not have any direct impact on general assistance, so we're not going to be discussing it during this training, although there obviously may be some trickle-down impacts that are yet to be seen in the future. Next slide. Okay, GA eligibility. So number one, you have to be a resident of Santa Clara County. And so that means at least 15 days continuous physical presence and intent to remain indefinitely in Santa Clara County. You don't need an address. Many of the recipients who receive GA are homeless or unhoused, so that is quite common. You do need to be a citizen or have legal immigration status to receive GA. This is a program for adults age 18 plus without children, without dependent children. Sorry, I should say that. You must have no other means of support. So it must be a program. So it's a program of last resort. It's really intended to be, you know, the most basic type of safety net. And that's kind of demonstrated by the level of benefits, which are extremely low, especially given cost of living in this region. Not eligible for any other cash aid program. So if you're receiving CalWORKs, SSI, SDI, UI, etc., obviously, that income would exclude you from receiving GA. And Jiyoung is going to talk a little bit about how SSI and GA interact because they do have a relationship. And then you can be unemployed, employed but making less than the grant level, which is again $343. So you have to be earning, very, very little in order to retain eligibility, or unemployable due to disability. Next slide. All right. Where and how to apply. So there's a few ways that you can help clients with their application. You can apply online using benefitscal.com. You submit an online application, and then there is a required interview that happens afterwards. So they'll usually call and schedule that interview. You can call in by phone and do the process over the phone with a representative. You can print out an application and mail it in or fax it in. And you can also go in person to one of the social services agency's offices Monday through Friday, 8 a.m. to 5 p.m. Next slide. And I'm going to breeze through that because hopefully this is a reference document that you can come back to once the slides get sent out. Same thing here, just here are the offices where you can apply for GA in person in the South Bay. And this is, again, meant to be a reference for folks to come back to. All right, items needed when you apply. So one, you need a form of identification, so picture ID, driver's license, or 2 pieces of ID which have a signature and or physical description. Proof of residence in Santa Clara County, so that could be rent receipts, utilities bill, ID. If your client is unhoused and they really don't have anything to provide, they can also sign an affidavit, stating that they are a resident of Santa Clara County. So they'll need to show their social security card or application for a social security number. They'll need to show proof of immigration status or citizenship, which could include a birth certificate, alien registration card, or green card. One thing I wanted to mention is that we have had clients who lost their birth certificate or weren't able to find their birth certificate, and social services actually may be able to assist clients who either cannot afford to request their birth certificate or they're having difficulty requesting it either from Santa Clara County or from another county or from another state. So if you do have a client with that issue, you can reach out to their DEBS worker or to the Social Services Agency Ombudsman, Mariella, and we have her contact information in this PowerPoint a little bit later. Reach out to them, let them know that you'll need help getting a birth certificate for the client, and they can usually assist with that and also pay for it. Proof of property. So many of the clients who apply for GA do not have any property, but if you have a client who does own a car or a house even, or has a bank account, being able to show that they meet the resource threshold will be an important part of the application. And then proof of income. So if they are working, being able to show pay stubs, any award letters, any other documents showing, where they're receiving income. And then proof of shelter costs and expenses. So if they are paying rent or contributing to rent or paying for utilities, bringing any of those documents to support their application will be helpful. Next slide. All right, benefit amount. So there's different benefit amounts depending on your living arrangement. So for one person living alone, the GA grant amount is $343. As I mentioned, this is reduced if they're living with other people based on the number of people that they're sharing rent and utilities with, or living expenses with. If you have a couple, I'm sorry, this should be two partners, not necessarily husband and wife, but a couple living alone would receive $460, so less than the grant that two people who are unmarried would receive, unfortunately, but it is $460. And then again, that's on a sliding scale depending on if they're sharing expenses with other people in their household. And then the last category that I alluded to earlier is a person residing in a state licensed board and care home. In that case, they can receive up to $929, but most of that is going to go towards payment to the board and care, and the client is only going to receive about $28 of that $929. Next slide. All right, we have a pop quiz. How much would a person who's living in a county shelter receive in GA benefits? All right, we're at 64%. Okay. All right, I think we've reached stasis. 72% participated. Okay, so most people said $343. $150 was the second answer. And I'm sorry, this is a little bit of a trick question. But quite a few of you all got it right. It is C, $150. And let's go to the next slide and we can talk about that. Okay, so the reason it's $150 is that the county does not generally provide the full general assistance rate if you are staying in a county shelter, because the assumption is that your housing expenses are being covered by the shelter. So you don't need the full $343, which is, a little bit laughable. But so in the past, the county never provided the full $343 to unhoused GA recipients because the expectation was that you would be offered a bed in a shelter and you wouldn't need the full $343. So this policy has changed a bit. Now the county must first offer unhoused individuals a shelter or motel bed. And then whether the individual accepts or declines the bed, the county can reduce the GA amount accordingly. So if the unhoused individual declines the bed, but has an acceptable reason, they can still qualify for the full $343. So if you accept the bed and you're living in the shelter, you're only going to receive $150 because the rest is considered housing expenses. And if you don't, the county will assume you don't have housing or utility expenses. But if you decline the bed, you can get the full $343 if you have an acceptable reason. And And I see a question in the chat about what are acceptable reasons. So the first thing you'll want to know is there is a form that needs to get filled out. It's the homeless shelter screening form and sworn statement. The form code is GA2495. So automatic exceptions are generally for concerns about health or safety at the shelter. And that could be things like an abusive partner or a trafficker knows where the shelters are and may look for the client there. The available shelter is close to the home of someone an abuser or a trafficker, someone that they have reason to be afraid of. An abusive partner is also housed at the shelter. Someone at the shelter made threatening remarks or harassed this client in the past. Those are common reasons why a person might have an automatic exception for health or safety reasons. Some other ones are if a client is concerned about contracting COVID-19 or some other illness, if they are immunocompromised, for example. And then also one that's really common for our clients who have mental health issues is that the shelter environment would exacerbate their mental health symptoms. You know, the stress and the anxiety of being in close quarters with so many people, that could be a automatic exception. There are some circumstances that do not necessarily qualify, but may qualify, and I'll just kind of briefly go over them. One of them is having a pet. So many of our clients have pets that they want to bring into the shelter. This may qualify for an exemption, but only if the shelter cannot accommodate their pet. So if the shelter allows them to bring in a pet, then they can't say, well, I don't want to stay in the shelter because I have this pet. Another common one is they don't have transportation to the shelter. That wouldn't qualify for an automatic exception because transportation can be arranged. And then also having items that they don't want to leave behind. So if the shelter can accommodate the items that they want to bring, for example, if they have a bike they want to bring and the shelter has bike storage, that wouldn't qualify for an exemption. So it's a case-by-case basis, and you have to fill out the form and have it reviewed by the agency. But generally focusing more on health or safety concerns, disability or mental health related concerns is usually a faster way to get to shelter exemption for folks who cannot stay in a shelter. All right, next slide. Okay. Emergency support payments. So generally it takes about 45 days for determination of eligibility and approval. That's kind of the timeline. But in some cases where clients need emergency cash aid, they may qualify for an emergency support payment. This payment cannot exceed 25% of the maximum monthly aid the person is entitled to. So it's still a relatively small amount of money, but it might be, enough to tide someone over or help someone for a few days. So the requirements are that the applicant is in dire need and is or will be homeless within the next 5 days. Eligibility is apparent, so it doesn't necessarily have to be verified, but it seems like the person will qualify based on income, assets, citizenship, etc. And the applicant has not received an emergency payment in the last 12-month period. So those are the 3 requirements for requesting an emergency support payment. All right, I'm going to hand this off to Jiyoung now to continue on with the beginning date of aid.
Hi, everyone. So my name is Jiyoung. I'm also a staff attorney on the health team at Law Foundation of Silicon Valley. Following up on where Maya left off, so in terms of when general assistance payments begin, that will depend on which happens earlier of the following situation. So the date of the date when they are determined eligible for GA, or the 10th day following the date of filing a signed application. And what is considered the date of filing? The date of filing is the date that the applicant submits the signed application for GA, as well as an identification and intake record form, okay? Next slide, please. Okay, so vendor payments to landlord. This is kind of tied to what we were talking about earlier with Maya in terms of maximum amounts of payments, or the maximum amount of payment a recipient might actually receive in their pocket. A situation like this is when the applicant chooses to receive a personal needs amount and have the remainder or the balance of their maximum GA payment paid directly to their landlord, okay? And so they can opt to not receive a personal needs amount and have the entire maximum GA payment paid directly to the landlord, the vendor, or they can keep a certain amount and have the remainder sent to their landlord. And this does require a verification of housing costs. And so this is also reported to the IRS and the FTB on the W-9 forms. And they have to make this election on the housing assistance statement form in the beginning of the application process, okay? And also, just to add, this is not something that they can opt in and out whenever they choose. This has to happen either at a redetermination or if they have a change in residence. Next slide, please. Okay, so what must a person do to stay on general assistance? There are reporting requirements. So in general, if a person experiences any change to their income, their housing arrangements, their circumstances, they must report it to the county within 10 days. However, aside from that, they also have what are called SAR-7 forms, which are essentially recertification forms sent to them every 6 months so that they can report changes and so that the county can make sure that that there has been no change in their circumstances to warrant a change in their payment or their eligibility status. And in addition to reporting requirements, again, general assistance also has employment requirement forms. So a person has to be looking for work, or they have to be working in order to receive GA, unless they are deemed unemployable. And so what this looks like is that most people will participate in a VS or a vocational services program, and they have to make good faith efforts. So they have to show that they're trying either to be employed or that they're working, and this turns out to be a monthly requirement, right? In terms of whether a person can opt out of this work requirement, that is possible. And you'll see here that under the unemployable option, if that's something that if they can get their doctor to certify, a doctor can verify that this person is too disabled, for instance, to work, in which case that person would be exempt from the employment requirements of this program. And then GA, like any other public benefit program, has personal property allowances. Essentially, they are required, not required, essentially they are allowed a maximum of $500 in resources, and a car, a personal vehicle of up to $4,650 is exempt as well. Next slide, please. Okay, so due process requirements. So if there is a change, if there is an adverse action taken on their benefits payments, right? If they receive a change in benefits, if their benefits go down, or if they are suspended or terminated, or something happens to their eligibility status that is adverse, that is essentially bad, or not desired for the recipient, they have due process rights, and they will receive notices of action from the county. And it will have deadlines for how to appeal, deadlines and instructions on how to appeal the decision made by the county. And I believe you have to request this appeal within 7 days. That is on the date of the notice of action. And from there, the recipient is able to go on to a state hearing, possibly with an administrative law judge. And this is the part where organizations like legal aid nonprofits, like Law Foundation, will typically get involved. We are not typically involved in the initial application when the county first makes a determination of whether the applicant is eligible for GA at all. But if the applicant receives an unfavorable decision beyond the initial application, then this is typically where lawyers will get involved. Yes, thank you. And so like I was saying, appeals encompass a number of issues. So they can be denials of GA, the benefit amount is lower or less than it should be. They have abruptly stopped. The most common issues at appeals. And below are the instructions to appeal to the hearing officer. Actually, method of ways to do it. So they can appeal in person, at a social services office, by mail, by fax, by phone, and they can do this also online through their benefits Cal account. Next slide. So what happens when we run into issues here? We have a number of steps outlined here that you can take to try to resolve the issue, or perhaps to get more information on what's happening in a particular case. Number one is to always get a signed release of information that allows you actually to speak to the county, and the county to speak to you about the person's general assistance case. You can also contact the eligibility worker listed on the top right corner of notices that they receive. The eligibility worker's name will be listed along with a phone number. And if you don't know the eligibility worker or who that person is, you can contact the supervisor, and we've provided a phone number on the slide as well. You can also contact DEBS, which is the ombudsman for the county, Mariela Moncayo, and if you contact the ombudsman, they're particularly helpful in terms of when you kind of run into a dead end. You try to contact the eligibility worker, or you try to contact the supervisor and you get no response, or essentially, if you kind of run out of options there, we suggest contacting the ombudsman. And lastly, you can refer the client for legal assistance, and that is why Law Foundation is here. Our staff is here, and we can try to help resolve the issue if we have the capacity. Next slide, please. So this is the County of Santa Clara's social services ROI that they use for all their programs. We just wanted to show you what the form looks like. It's pretty straightforward. And I believe we'll be sending this form out after the presentation as well. Some common issues that come up. So for when you're helping homeless individuals, it's important to note that a lot of unhoused people do not have, obviously a lot of them won't have a set address, in which case they can use a mailing address of a friend, a relative, a PO box, as long as it's in the county. They can also utilize a social services district office or general delivery services from USPS. I see that we've included home visits here in the cases where the applicant is unable to come to the GA office for the interview. And I see that this does include patients who are at or people receiving inpatient care at Valley Medical Center. This might depend on your specific organization's policy, so I would refer you to asking somebody on your staff. Language access, yes, they should. Social services should provide language access. So there should be a way for you to get an interpreter on the phone with you should you have a client who is unable to speak English. And then another issue we run across is when landlords and vendors will not want to fill out a W-9, in which case the client can just fill out the housing assistance statement form, and from there the payment will be issued via warrant to the landlord. Okay, so another pop quiz question. So GA, so this is a true or false question. Is GA a loan? GA is a loan and you need to pay it back to the county when you can afford to do so. Is this true? True or false? Okay, I see. Answers are kind of, okay, so I think it's set. I see most people are saying it's false. A few are saying it's true. Okay. Okay, so majority of people are saying it's false. So I will end the poll at this point. Okay, and is this true? Can we go on to the next? So, since 2014, general assistance benefits are no longer considered loans in Santa Clara County. This can differ by county. However, for Santa Clara County, it is GA benefits are no longer considered a loan. Benefits do not have to be paid back to the county unless you are eligible and approved for SSI for the months you receive GA. And we're actually going to talk about this in a forthcoming slide. The other situation where you can be required to repay GA is if you were issued an overpayment of GA benefits. Can we move on to the next slide, please? And so, as I was saying, so GA recipients who are unable to work because they are disabled, and that disability is expected to last 12 months or longer, they are required to apply for SSI and or SSDI benefits. I believe these applications are made concurrently at the intake level with the county social worker or eligibility worker. And if you want to find out more information about this program, there is a phone number listed there. So this is a requirement for GA recipients, and if they do not comply with this, GA can be discontinued unless they can show reason as to why they did not comply with this requirement. And then we have classes of people who are considered eligible for GA and who are not. Again, generally, one must be a citizen or a lawful permanent resident. And then there is another class of non-citizens who may receive GA. Generally, these fall under follow under the Immigration Reform and Control Act, or VAWA, or Violence Against Women Act of 1994. And essentially, if you refer to the handbook goes into much more detail about very specific immigration categories. There's also separate cash programs for U visa immigrants and refugees. We do want to note that. And then in certain rare cases, an undocumented GA applicant can be approved for GA as a director's exception, but we don't see this happen a lot. Okay. Next slide, please. And related to the SSI, the concurrent SSI applications made at the intake level when somebody is applying for GA, there is what is called an interim assistance reimbursement. And this allows counties like Santa Clara County to recoup the GA benefit payments that were paid to the recipient while their SSI applications were pending. This only applies if the SSI or CAPI applications are ultimately granted and the person is eligible for those programs. If they are eligible, if they're approved, then the county will be able to recoup the GA benefits that were paid to the recipient. And of course, if they were denied, then the GA benefits will continue as before. Next slide, please. And then you see the interim assistance reimbursement form, just to give you an example. Next slide, please. And that's it. That's all for our presentation. Do we have some time for questions?
Yes, we have plenty of times for questions.
Okay. Looking over the chat here, I think Maya has explained or answered most of the questions here. If anybody has any questions, feel free to put it in the chat or raise your hand, please, or just speak out into the audio.
Wei, I see your hand up.
Yes.
Let me ask to unmute. Let's see.
Sorry, can you hear me now?
Yeah.
Yes.
Okay, sorry. About utility bills, I understand they are supposed to submit the bill. Do they need to submit every month, or once they submit once and then a set amount is determined and they'll continue receive that that payment until the situation changes?
I believe they can submit it once when they first apply for the program and are approved. After that, if they're, and this is the reason why the county sends out SAR 7 forms so that people can report if there are any changes to, their financial circumstances. So generally, people, unless something changes, I mean, and regardless if anything changes or not, they are required to report their finances to the county every 6 months on the SAR 7 forms.
So okay, thank you. So the amount is that's up to $193 that housing assistant, part of the housing assistant they can get for the utility assistance.
Maya, I believe it's within that portion, right?
Yeah, so you can only receive a max of $343. So yeah, if they wouldn't be compensated for utility bill that goes over that amount.
I see. So that $193 that would include the special needs, that's a separate special needs, a motel reimbursement, and then utilities. Is that right?
That's right.
That's all within that 193. One last question. So that's in addition to the $50 if the county pays, if they have a housing voucher and the county pays that $50 directly to the landlord. 193 is in addition to 150 and then 50. Is that right? So that $50 rent payment is not included in this 193.
I'm not sure. Are you asking for, maybe we could talk about this as for a specific client?
Right. So if a client has housing voucher and then they pay $50 rent, and the social services agency can pay that $50 rent directly to the landlord, so the client still keep the $150 GA. But if they request utility assistance, they may be, up to $193, but that $50 rent assistance is not included in that 193. So you don't.
I believe the $50 would be included if it's being paid directly to the landlord as rental assistance. It would be part of the 193. So you would still be capped at 343 for the total GA grant.
I see. So it's 193 minus 50. Okay, got it. Thank you.
So I see Lizette asked, is it recommended for individuals that have been deemed unemployable and are enrolled in GA to apply to SSI or SSDI so that they can pay back into the GA program?
That's required.
Mhm.
That is required. It's not something that they can just opt out of. They will be required to make concurrent applications to GA and SSI or SSDI.
And kind of the reasoning behind that is it's easier, the county wants people to get onto federal benefits so that one, you have access to a much higher level of benefits, and two, it kind of removes some of the financial burden from the county. So that's why they have an SSI advocacy program that supports people in submitting these SSI, SSDI applications.
Can I ask another question if nobody else has questions? So for the shelter bed availability, we have helped a client to apply if they have mental health issues and they cannot sleep in the shelter. And then the social services have been pretty quick at granting them that additional 193. But for the clients who cannot get shelter beds, the wait is pretty long now. It could be several months. We did use the same form to apply, but that client so far it's been a couple months, still hasn't got a response for the shelter beds, for lack of shelter beds to get the additional 193. Is there another form to request when there's no shelter bed rather than when you cannot sleep in a shelter?
Sorry, as far as I'm aware, I think that would be the correct form to use. If you're not getting a response from the field office, I would refer back to the slide that Jiang went over about escalating. So, talking to their DEBS worker, talk to their supervisor, and then reach out to Mariella. And as long as you can kind of say, look, like, we reached out to the DEBS worker on this date, didn't get a response. Reached out to their supervisor on this date, didn't get a response. And then Mariella is very responsive. So, if you've gone through those steps, usually she is pretty good at letting, getting you an answer about why it hasn't been resolved or resolving it herself.
Okay, thanks.
So I do see one last question here. So for clients who are deemed unemployable with GA, and they are still waiting on a decision from Social Security, Unfortunately, there's not much that they can do. I know it's been a while. I know they've been waiting several months. I see here it's been 9 months to a year. That is not unusual, unfortunately, for Social Security to take that long in making a decision about whether the client is disabled or not. And so, unfortunately, there's not much you can do to make Social Security, hurry up on making a decision regarding the disability. If you do have somebody in this situation, maybe a referral to us is appropriate. We can try contacting Social Security and see what's happening with the client's case, if there's been any, there's been any movement at all, or just to check the status of it. So yeah, I'm sorry. There's not much you can do when the client's just waiting on a Social Security decision.
And the reimbursement is a 50% of the GA received from the back pay only, right? Not from the future payment, only from the reimbursement from the back pay of SSI or SSDI once it's approved. Is that correct?
I'm sorry, your question was 50% of the payment?
Yes, 50% of GA payment received. Is that correct? I only saw one case helping the client. I think was Social Security requested 50% of the GA received.
Is it 50%? I thought it was the entire amount.
Yeah, I think in the cases, I thought it was the entire amount also.
Yeah, we normally see people's entire amounts be recouped by the county. In that particular case, that might just be dependent on, that person's situation, and, we'd have to look at that in particular, but most cases, the county will take back the full amount from the retroactive SSDI pay.
What if the back pay is not enough to cover the all GA amount received?
You mean if the SSI payment is not enough to
Yeah,
cover the
right.
GA that they received?
Right. Is it from the back pay of the SSI or is from any payment, future SSI payment also?
Yeah. So generally, if they have been receiving GA benefits for a while and then they are finally approved for Social Security benefits, Social Security from whatever, so sometimes it might be sometimes it's like a lump sum kind of payback, but it can vary, but they will take from the continuing SSI payments
I see.
until they have satisfied the GA amount that the client received.
Got it. Got it.
And
yeah.
generally, generally your SSI benefit is going to be higher than your GA benefit. So and you're receiving it for the same number of months usually. So, I mean, you are receiving it for the same number of months because the recoupment starts from when you apply for SSI. So I've never seen a case where the back pay didn't cover the GA reimbursement.
Got it.
Good morning. This is Maria. I have a quick question. I put a question here regarding the notice of actions. I have a client who applied for, was receiving GA, applied for EDD, unemployment benefits, received one check, and then became ineligible. And during the appeal process, we uploaded documents for the eligibility worker, and we never got a response. So when you're looking at a 7-day turnaround and we're not getting it, what would be the next step if we're, besides just contacting the ombudsman, which she's excellent in responding, her time is quick.
So have they appealed the
Yes, we
notice of
did that.
action?
Yes, we did that together. It was the initial uploading became disqualified letter from EDD, and then it was the appeal. And here's the other part. Fortunately, he became employed. So it's twofold. Besides the appeal process, would he be eligible for back pay from the time that he did not back pay, but reimbursement? I guess we're talking retro from the time that he was disqualified for unemployment benefits.
Um, so he was found, so he did receive an EDD payment,
He received one payment, yes.
and that was all that he was due,
No, he was eligible for
or
more.
more.
Yes,
But in the
I
meantime,
also
received,
assisted him in appealing the decision for unemployment. It was one of these situations where UPS closed all these businesses, and then they wanted to turn around and say he stopped coming to work, which was not true. So many uh, uh, of these offices closed due to Amazon cutting relationships. So bottom line is he was only eligible for one check, and then he became disqualified, and we appealed that. In the meantime, he has no source of income, and he's living in a program where his rent is low, but he still is responsible for it.
okay. So a case like this is pretty specific, and I don't think we're allowed to give really specific legal advice over this presentation. I would refer that client to us so we can go ahead and take a look at his case.
I'll do that.
Um, but from based on what you're telling me, I think this is just a matter of like agencies kind of lagging.
Thank you.
Um,
That's exactly why the
yeah.
point.
So yeah. So I mean, if you can refer that client over to us, that would be that would that would allow us to take a closer look at it.
Okay, I'll do that. Thank you so much. And
course.
thank you for your presentations.
Of course. Okay, so any other questions?
I don't see any other questions. Lorena, if you are still here, I think it was one question pertaining to your presentation, asking it if for a teen mom who wants to apply for WIC, what income is reported. Also, Diana, if I can't get that answered today, we can follow up with you via email. And I also am going to put in the chat a feedback survey for today's presentation. If it takes like probably like 3 to 5 minutes at max, just to give us feedback on how today's presentation worked for everyone. And I'm going to stop my share just to see everyone. But again, thank you all for attending. Thank you to our presenters, Jay Young, Park, and Maya Fegan, also Lorena Kuhn for presenting today. My apologies for my Freudian slip earlier saying Bay Area Legal Aid. Thank you to the Law Foundation for presenting on general assistance. And if anyone had any questions, please feel free to contact me directly. Like I said earlier, the slide decks and the recording will be sent out. And when I send out the slide decks, also the presenters' contact information will be there so you can contact them directly. If there's no other questions, we all can leave a bit early. Thank you again for joining.